I like to joke that the consultation for a breast augmentation is almost longer than the surgery itself. Mm-hmm. And that's because it's important to understand what is going into your body, what it feels like, to understand why I'm making a choice for a softer gel or a firmer gel when comparing it to your tissue subtype, meaning the firmness of the breast tissue or the softness of the breast tissue of a particular patient. So I really want patients to not just blindly go with what I say, but I want them to agree from an educated basis to say, yes, I understand what you're saying. That makes sense to me too. I understand why we're doing this. I feel good about it.
And it feels the same from the office.
So Jana is a really active mom, like many of my patients. And I think it's really important, again, as part of making sure your patients are educated, that they understand the risks and benefits of surgeries and the downtime and the appropriate care. You know, this is a team sport. I really do believe that you should get back to active life and get back to your life as quickly as possible. And so patients are back to moving around and being with their family and being an active part of the household quickly. But as we all know, surgery is still surgery, and aesthetic surgery is no different than any other surgery in that you have to make sure you have the time to heal. And so what's really important for moms is picking up kids in and out of cribs, in and out of car seats. At that extended position, you can cause damage and cause injury in that healing period. Once you're healed, everything's fine, but we want to make sure that patients understand they need support, they need help doing some of the things that all these super moms do.
And Dr. Unger did tell me all of these things, but I also called him like 10 days post breast augmentation surgery. And I was like, hey, I just got offered to go do this movie and I have to like be running and do machine guns and like this total action. He's like, no, you cannot do. I was like, really? Like you don't think I can do that? He's like, no. And I was like, oh, fine.
Yeah, we talk about it. Patients still hear what they want to hear. Like, I feel like this is totally going to be fine, but it's not so fine.
Yeah. The day before surgery, I think I texted you too, like, I'm so nervous.
Yeah, you made a call 3 times, a couple of FaceTimes.
I might have done that.
Yeah.
I was nervous. It's nerve-wracking because I'm like, what if I don't like it? What if I can't undo it? What if I don't like the scars? What if I don't know, what if I just don't like it? Because it's a big change, it's a big surgery. And again, the morning that I showed up, I saw him. I had a wave of just like, okay, everything will be fine. I'm in the best hands possible.
Sweet, thanks, Jana. And for the surgeon, the day before surgery is every day. So, you know, when taking care of patients, you do want to think, I do find some time to center myself and focus in the mornings and the night before each surgery and the mornings of each surgery. And it's just kind of going through your plan, looking through my notes, making sure I have the right game plan. The informed consent process continues through the morning of surgery. Paperwork is signed. There are no changes obviously really happening that morning. And so in that process, we just make sure that the patient and I, like Jana and I, that morning of surgery, we're on the exact same page so I can go into surgery with a clean game plan and to just enact that plan to give the perfect result.
It's really great to keep that friendship with your surgeon because these are not lifelong devices. They will have to be eventually switched out, but it's just to have that open communication, to be like, hey, you know, things are kind of, you know, getting a little different, you know, maybe when I get older. And also he needs to continue to help check my, you know, my boobs, make sure they're doing good. And yeah, I mean, again, I consider him a friend.
And I consider you a friend, Jana. And you know, I think it's important, at least for my patients, it's not surgery and see you never. I'm her plastic surgeon, I'm also one of her doctors. And so I see all of my patients annually after the entire recovery period is, you know, multiple times throughout that first year, of course, and then on an annual basis. I'm an expert at breast surgery. I'm able to not only examine the patient, make sure they're happy, make sure there are no changes, but it's a medical breast exam too. You know, we always want to make sure we're taking care of the health of our patients first and foremost. And of course, the aesthetics and the shape and the contour and the implant is what we're mainly going to talk about. But I want to be there for all of my patients. So when it comes to breast health, you know, I also perform breast reconstructive surgery after mastectomies and breast cancer. And so I feel it's incumbent upon me as a physician to make sure that my patients are well educated and hear from my office as well. Self-exams, mammograms starting at the appropriate time depending on risk factors or just general consensus guidelines, and just be another positive factor to help make sure patients are taking care of themselves.
I am so obsessed with my new look. I feel like I'm back to myself, and it's been an incredible journey to look in the mirror and feel proud of the decision that I made for myself. I feel proud of my body, and to give myself maybe a little wink on the way out.
Well, as you just heard from Jana, there's nothing better. I mean, I think this is why we all do what we do. I mean, that's the reason I do plastic surgery. And so there's nothing more valuable to me than having happy patients, healthy patients, and just loving what we're able to provide for them.
Thank you
You're so welcome.
for bringing me back to me.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.